We are starting to see a whole host of numbers trickle in. Brand new numbers on the public's reaction to health care reform. Check these numbers out. New Rasmussen polling, 41% of likely voters say health care reform is good for the country. 50% say it's a bad idea. Why has this been such a hard sell? Scott Rasmussen, independent pollster and president of RasmussenReports.com. Scott, good morning to you. Why is it so hard to sell this to folks you're talking to?
Well, let's remember, first of all, we're talking not about health care reform in general. People want to see the system reform. They want to see something that will reduce the costs. They don't like the law that was passed. And the dynamics of the perception of the bill are the same as they were before it was passed. Democrats really like it, think it was good for the country. Republicans and unaffiliated voters say not so much.
So that's a political breakdown, and let me keep that in mind here as we put the next one on the screen. Do you favor repeal of the health care bill? Strongly favor, 44%, 10 points higher than strongly opposed. What are they telling you in that number? And is there a political breakdown to that, Republicans, Democrats, Independents, that you know of?
Absolutely. There's a huge divide here. Overall, 54% of Americans at least somewhat support the idea of repealing the bill, and that's virtually identical to the number who opposed the bill before it passed. 84% of Republicans support the idea of repeal, 59% of unaffiliated voters. Among Democrats, 25% of white Democrats support repeal, but black Democrats overwhelmingly are opposed.
Okay, what about the deficit? You asked about this question, too. And you wanted to find out whether or not people thought it would reduce the deficit or increase it. 60% say we're paying more. They're not buying the cost reduction, Scott.
No, look, in Washington, D.C., everybody says the Congressional Budget Office numbers are gold. But across America, people don't believe them very much. Only 1 out of 10 Americans believe the CBO projections. 81% say it's going to end up costing more than projected, which will lead to higher deficits. And people are concerned it will also lead to a higher cost of care and to an increase in middle-class taxes.
That's on the price of the bill now. What about the quality of care? You asked about this, too. Will it get better or worse or stay the same? 49% think their health care is going to get worse. Where's the confidence in that number?
Well, there isn't any. And, Bill, if you went back and looked at our last 6 months of polling, we've been tracking this issue every week. This number has barely budged since Thanksgiving. Before the bill became law, people had the same skepticism. After it passed, nothing has changed. Now, we don't know what the numbers will be in October or November, but if they keep looking like this on Election Day, it's very bad news for the Democratic Party.
One more thing here, and I think this it refers back to the deficit question we asked before. They're related in the following sense. Do you think your health care costs are going to go up or go down? 59% think the cost is going to go up. So do they believe that they're the ones who will be paying for it?
Yeah, of course. People are skeptical about a government program. People who have good insurance are worried they'll be forced into some new program. And people just have a generic skepticism about this. Only 17%, 1 out of 6 people believes that this legislation will accomplish its goal of reducing costs. Big uphill battle if you're trying to sell this plan.
Scott, thank you for that. This is really the first glance we're getting here. Other folks are out there doing polling numbers, too, that in many ways mirror what you're producing here. And we've got our own team on it, too. So we'll find out a little more about our own numbers at the end of the week. Scott, thank you. Scott Rasmussen, this is the first taste of what America thinks about us.